The following is a project of our nonprofit newsroom. Support Midcoast Morning and local community-centered journalism today by signing up to be a monthly sustaining donor at chly.ca/donate.
Hello and welcome to Midcoast Morning. I'm Joe Pugh. The province's nursing union is flagging workplace safety concerns and staffing shortages as they get ready to head to the bargaining table later this year. The BC Nurses Union's collective agreement with the Health Employers Association of BC is set to expire at the end of March. As the union gets ready to negotiate its next agreement, they've been having a series of regional bargaining conferences, including one most recently in Nanaimo. Today on the program, I speak with Kelly Charters, a registered nurse and a regional council member for the BC Nurses Union.
On January 9th and 10th, 250 nurses from across Vancouver Island all met in Nanaimo. It was called our bargaining conference, and we were here gathered to really establish a united front as we go into bargaining and really set our priorities and understand what the issues are facing nurses from across the island.
And what are the concerns nurses are looking to address in their next collective agreement?
Yeah, so we spent some time reflecting on a lot of the gains we had in our last round of bargaining, including our wage increases and some retention bonuses. But what we really spent a lot of time reflecting on is the fact that our working conditions are still not very good. In fact, quite bad. Nurses' safety, workplace violence, the impact that the nursing shortages have had on our nurse members is very dramatic, very telling. And so we spent a lot of time talking about how do we address those issues.
And before we get to that part, how do we address those issues? Could you just provide more detail on what exactly those issues look like?
Yeah, so for us, one of the things I want to talk about is actually what's happening in our healthcare right now. Across the island, we're seeing a tremendous amount of pressure with high usage of our hospitals. Most of our hospitals on the island, if not all, are over capacity, which means they have more patients in them than they were designed to hold, which means patients are in the hallways and in alcoves, places not designed for patients. This weekend alone, this last weekend, there was 50 patients in the ER department of Nanaimo Regional General Hospital that were admitted waiting for a spot in the tower. So that's 50 people in the emergency department who have already gone through all of the processes of emergency and are just kind of hanging out while the nurses there are trying to cope with the already high volumes that come through the door. And this is like a common theme we're seeing across the island at all of our sites and certainly across the province. And so what it does is it puts just tremendous pressure on our nurses. The violence increases because we're seeing people who are frustrated, who are in the hallways, legitimately frustrated. We're seeing increase in safety issues around the violence and around just people being frustrated. We're seeing increase in substance use issues in the hospital, which is another big incident. And we know substance use is a big problem in the public and it's an epidemic in this province. But that trickles into the hospitals. And so nurses are being exposed to hazardous drugs at work. And then the staffing shortages really affecting the morale because nurses want to provide good care to our communities. They are our families. They're our community members. They're other nurses, and we want to provide good care. It's really hard to do when you've got too many patients.
There are a number of things there that I want to follow up on.
I know, I went way in. All of it.
Maybe just to start, so the province is working on implementing minimum nurse to patient ratios. Could you tell me more about how that implementation process has gone, whether the ratios are being met in our region, what that kind of looks like as it unfolds?
Yeah, that's a great question. And I love to talk about ratios. It's really exciting work. The minimum nurse to patient ratios sets a standard for the amount of patients each nurse can safely look after. We've had the government announce what that is for many areas within acute care, and it's going to expand to all areas of healthcare. And we're continuing to do that work with the Ministry of Health and the health authorities. So really exciting work happening. The rollout for minimum nurse patient ratios in our medical surgical inpatient units, our palliative units, and our intensive care units is happening right now in Island Health. And so they're actually, Island Health is up in the North Island this week, and they're rolling it down the island. So they're up in Campbell River, Comox, and the North Island, Port Hardy, Port McNeil over the next 3 weeks, really just starting to build the framework to have minimum nurse patient ratios in place. And what that means for nurses and patients, it means that on a medical surgical unit, for example, the standard will now be 1 nurse for every 4 patients, which is really, we know, provides greater quality of care for patients. It helps with the retention of nurses. It decreases mortality rates, decreases infection rates, all the good things that we want to see. And so we're not there yet, though. We don't have enough nurses. But that's
I was about to say, what is the pathway to getting there? Like, do we have enough nurses? Is it just a question of having enough nurses to be able to do that?
Yeah, I think part of it is system changes. So we haven't had a standard way of talking about like what is the safe level of patients each nurse should look after. So this is providing us that framework to say like 4 patients for each nurse is the safe amount. Because right now we're seeing upwards of 8, sometimes 12 for each nurse, which is now that we have the language to say like that's not the right number, which is great. But what it also is doing is attracting nurses to come back into the system who may be underemployed as casual or may have gone to private agency nurses or traveled elsewhere. It's attracting nurses to come here from other provinces. And so we are seeing an uptake in hiring of nurses in BC. We are seeing nurses saying they're coming here because they know we're going to get ratios and they want to work in these really good working conditions. So it's going to take time. We're not going to get there overnight. This is not a magic pill that's going to fix it as soon as we turn on the light. We need to build the systems, work with the post-secondary education systems, and really make nursing a desirable place for people to work, because that's really going to be the key to really correcting some of these issues.
You touched on post-secondary education there. VIU here in Nanaimo, there's a nursing program. According to the website, they have 80 people admitted to that every year. There's also a program at North Island College in the Comox Valley. Can you give me a sense of how close maybe the number of people who are able to complete programs here in Vancouver Island or in BC, how close that volume is to over time addressing staffing shortages in nursing?
Yeah, I think we're headed in the right direction. We're seeing initiatives come out through the Ministry of Health to incentivize and help new graduate nurses as they come out of the program so that they stay in nursing. Things that help them pay for their exams when they come out, incentives to attract people to some of our rural and remote communities, financial incentives, and some incentives to help people stay in those communities. So those are all helping build a framework to really support our new grads, because what we've seen over the last maybe 10 years is the nurses who are leaving nursing are our young new nurses, because they come into the system really excited to be a nurse. They've spent a lot of money to go to nursing school. They put a lot of time and effort, and then they get into the healthcare system and it's not what they expected. And it's a very, very hard place to work. And so they leave, and they leave at a really high rate within the first 5 years. And so working with the post-secondary schools, working with the Ministry of Health and the health employers to make the working conditions better is really the key to getting nurses to stay. And we're starting to see some of that work help. I think what I'm hearing from Island Health is the last graduating class from last year Over 90% of them are still in the healthcare system on Vancouver Island, which is great news for us. And we just have to continue to build that work and continue to work with the nursing students to make it really an exciting place to come and work.
So it sounds like maybe the biggest issue is this sort of chicken and egg problem where nurses are leaving the profession because the workplace conditions aren't great, and the workplace conditions aren't great because there aren't enough nurses in the system. And you mentioned there that it's maybe the key area of this is people who have just recently entered nursing. Within the last 5 years, they've entered the system. What are the specific things to help keep those people in nursing?
Yeah, I think one of the things in the working conditions that we can address and that should be addressed that's not related to just the number of nurses is the safety piece. We did a survey last spring, I think it was, of our nurses on Vancouver Island, and it showed that 44% have been exposed to weapons in the last month. 68 have been exposed to illicit substances, and 54% have been exposed to physical violence, and up to 83% have exposed to verbal and emotional abuse over just 1 month period. And so what that tells us is that there's not enough supports in place to keep nurses safe. And it can only take 1 or 2 traumatic incidences like this to be like, I'm out. I'm not going to be a nurse anymore. It's not safe here for me when you're exposed to weapons and you're exposed to violence at work. And so other things need to be put in place to keep our nurses safe. And that goes beyond just increasing the amount of nurses in the workforce. That includes like bringing in security measures, bringing in policies that to maybe take weapons away from patients, to take substance uses away and make safe places for people to use substances on site that's not in their rooms and not in their bathrooms and things like that.
Well, on that front, in Nanaimo recently, we've seen across the street from the hospital a pop-up overdose prevention site run by a group called Doctors for Safer Drug Policy. Can you give me a sense of how maybe nursing fits in with that whole issue, what maybe the nurse union perspective is on the issue of consumption sites around hospitals?
Yeah, that's a great question. It's actually something that we've advocated for, is to have safe consumption sites at hospitals and at places where people are using, because what happens without that is people are using inside the hospital. And we are all for mitigating risk for this population of people in preventing adverse effects. And so we want to support that population. We have a tremendous group of mental health and substance use nurses who advocate so strongly for this population, and we want to lift them up. We want to keep them healthy. We want to provide care. So none of anything that we're doing is to say, don't come to hospital. We don't want to provide care. We just want to do it so that we're safe too. And so if that means having a safe consumption site or on the hospital property, that's what we need to do. And that's something that we would definitely get behind and support as a way to kind of mitigate some of the risk we're facing.
Midcoast Morning is made possible by the Community Radio Fund of Canada and generous listeners like you. Support and grow our nonprofit newsroom project today at chly.ca/donate with a monthly or one-time donation. With your support, we can expand Midcoast Morning from 2 to 3 original programs per week to cover local news, current affairs, and arts and culture.
We're talking nursing on today's program. A group of nurses met at the Vancouver Island Conference Centre January 9th and 10th as the BC Nurses Union gears up for provincial contract negotiations. The union's current collective agreement with the Health Employers Association of BC is set to expire at the end of March. I'm speaking with Kelly Charters, a registered nurse and a regional council member for the BC Nurses Union. Last week at the conference in Nanaimo, BCNU President Adrian Geer told CHLY that the complexity of patients has increased. Can you tell me what that means?
Yes, it has, right? So our patients are coming to the hospital sometimes because they don't have family physicians. And so their chronic illnesses are not managed very well. Lots of people facing homelessness, lots of elderly people on the island. We know that we're a population of people who are getting older here. And so with the lack of primary care and the lack of family physicians, the patients and people in our community are just not having a lot of preventative care. So when they come to hospital, they might come in for, I don't know, a surgery. But then we find out all these other complex issues, which completely complicates their stay and makes it a lot longer in the hospital because we can't send people home who have all these other health issues that need to be dealt with in a timely fashion. So, yeah, the patients are certainly more complex. And then the other piece is we're doing really remarkable things when it comes to surgeries and things like that. We're sending people home way faster. Back in the day, you had a baby or you had surgery, you were in the hospital for 10 days. Now they're doing knee surgeries and you're going home the same day. So, which means our healthy people who were having surgeries and having babies and having things are not staying in the hospital, and that leaves behind just a mix of very complex patients. And so, a nurse who might have had an assignment with a couple of healthy people who had knee surgery, and then maybe one complex patient, now has an assignment with all complex patients because that healthy knee surgery person has gone home, which is great, but it just means that we actually need more nursing resources because what we're dealing with is a lot more complex.
How much of that you had the surgery and now we're sending you home on the same day is due to like advances in care and advances in the surgery versus odds are you'll probably be fine. It would be nice to care for you if we could, but there's really just not space here.
Oh, I would say it's the advances in care. So my background is intensive care and surgical. And so my last 10 years of working was in the recovery room. So near and dear to my heart. And it's actually quite amazing, the advances they've made in surgical procedures and our advances in the way we give general anesthetics and things like that. So I don't think that we're sending anyone home who shouldn't be going home. I think it's just that people are, and there's a lot more upfront too, a lot more prehab, we call it now, where we're getting people ready before surgery. So when they are having their surgery, they're ready to go. So yeah, I would say I'm not worried about people getting sent home early. I think it's actually probably a good thing. You're better at home.
Are there any factors specific to Vancouver Island around any of what we've been talking about so far today?
Yeah, I think for Vancouver Island, we are seeing that increased in aging population, and we haven't seen enough funding and resources put into increasing our ability to take care of people through long-term care or through our home and community programs. Home is best for people, and so we know that people want to stay at home. But if they need nursing care, it doesn't mean they need to be in a hospital. It means they need more community resources. And our community nurses are very, very stretched. Their caseloads are very high. And so that's another area where we are looking to be the first in the world to implement minimum nurse patient ratios into the community sector so that we can get enough nurses out to people's homes and keep them in their homes. But until we address those issues, we're going to continue to see the big strain on our healthcare system and our acute care sites. The other big issue facing people here in Nanaimo is the fact that the Nanaimo Hospital, the tower, is very old. It's from the 1960s, I think. We do need a new tower here in Nanaimo. And then that we also don't have the cardiac cath lab that they do in Victoria. So anyone facing any kind of cardiac issues north of Victoria pretty much has to wait and then get sent to Victoria. So that's another huge issue we're facing here in the Central Island and North Island.
And we saw in the provincial election campaign that both of the major parties running, including the one that was elected, pledged that there would be a new hospital tower in Nanaimo. How does the nurses union... What do you make of that news?
I mean, I've worked in Nanaimo for 20 years, and It's always been like I've seen plans. It's been a pipe dream for a long time. So I hope it comes true. I really hope this government keeps their promise and that they do build that tower. We are seeing like the commitments. They're building the new hospital in the Cowichan Valley. We saw the two new hospital builds up in the North Island in Comox and Campbell River. There's the commitment to build a long-term care site just north of Nanaimo and Lanceville and the border there. And that's going to have 300 beds, which is amazing. That's a huge facility, which will make a huge difference. So I think as long as the promises are kept and then you start to see these builds, it will make a difference in the long term. But it takes time to build.
So looking ahead to negotiations, the collective bargaining agreement, the current one is set to expire at the end of March. How do you foresee things going? Are there any particular issues that you so far as a union have set your sights on and identified as this is the thing we need?
Yeah. So for us, it's, of course, wages and benefits that nurses get are always going to be a top priority for our nurses. That's what we need to take care of our nurses, and in the economic climate we're in, those are important factors. But really, we're working on getting really united as a nurses union. We have 48,000 members across this province, and we know that we need to be united going into bargaining and stay united so that we can get a fair a collective agreement in this next round. But yeah, aside from wages and benefits, like I said, the next biggest priority is our working conditions. That is the thing that is driving people out. And we even hear nurses saying who've left, like, there's not enough money to bring me back to the system right now. And so really addressing those conditions of work, addressing the violence, addressing the nursing shortage, and continuing to build on some of the gains we saw at the last round is going to be key to really a successful bargaining for us.
So for someone who's not involved in the healthcare world, they're not a nurse or an administrator, they're maybe just someone who occasionally needs to use the healthcare system. What do you think is important for them to take away from the issues that nurses are flagging?
Yeah, I think I might have painted a scary, desperate picture of our healthcare system, and it is. We're in a really difficult time, but overwhelmingly, nurses are working really, really hard in really difficult conditions to make sure that our patients and our communities are getting the best care possible. And what I get also overwhelmingly is people from the public who maybe hear messages that I was talking about earlier and go into the healthcare system and they're kind of scared of what they're going to find. And they are pleasantly surprised by how well they are taken care of by the nurses of this province. And so I just want the public to really appreciate that the nurses are delivering really, really good care under really extraordinary circumstances, and just to maybe be patient with them, show some grace, be respectful, knowing that they're under a tremendous amount of pressure and that they are really doing the best that they can to make sure that nobody is left without good quality care in this province.
There's a provincial bargaining conference at the end of February in Vancouver. What do people need to know about the next steps on the way to getting a new collective agreement for nurses?
Yeah, so we just did a regional bargaining conferences for every health authority. So those are just about to wrap up next week, and then we will gather around 500 nurses from across the province in Vancouver at the end of February, where we'll come together and again bring together that unity, share what we've learned from all the different health authorities, see where we have common ground, and then also elect our bargaining committee. So from there, we'll elect our 7 nurses representatives from across BC that will represent us at the bargaining table along with our president and CEO. So really, it's an exciting time for nurses. It's a time for us to come together, set our priorities, and just really get excited about what the future of nursing can hold.
For people who have just maybe they've been hearing news about the Canada Post strike, they've been hearing news about the port workers labor dispute. They've been hearing news about the rail labor dispute. I feel like I'm getting a completely different tone maybe from this conversation. Do you expect it to be relatively smooth sailing in terms of by the date that an agreement is supposed to be reached, it will probably be reached?
It's really super early to tell because we haven't even engaged in those conversations yet. I think right now we're just really optimistic that we can go into it as a united front, because that is the key for us to get any successful bargaining gains or conclusions. So really at this point, it's so early, too early to tell where we'll be in a few months from now. Yeah.
Is there anything else then at this point you think it's important people know, or anything else you'd like to bring to the conversation?
No, I just thank you for this opportunity. I just really appreciate all the nurses out there who are working day in and day out under these really, really hard conditions. I hope they know that the BC Nurses appreciates them and that the public appreciates them. Nurses have the pleasure of experiencing support from the public at like really high rates. 83 or 84% of the public trust and respect the work that nurses do as the most trusted profession. And so I hope the nurses can feel that. I hope the employer and the government recognizes the important work and the professionalism that nurses bring to the table every single day. And and hopefully that brings us the recognition and the agreement that we need in the next round of bargaining.
CHLY Charters, thank you so much for taking the time.
Yeah, thank you. This is great.
CHLY Charters is a registered nurse and a regional council member for the BC Nurses Union. We reached out to the Ministry of Health, who provided a statement which said in part that nurses are indispensable allies in the government's work to strengthen the public healthcare system, and that the ministry will continue to take action to address the issues that affect nurses. The statement cited efforts between government and the BC Nurses Union to create 320 net new relational security officer positions, which it said have all been filled. The statement also said the government is exploring further expansions in that domain. It also cited the minimum nurse-to-patient ratios that came up in our conversation on the program today. That's our show for the day. Thank you for joining me. I'm Joe Pugh, host and producer of Midcoast Morning. Jesse Woodward is our executive producer, and Arby Frew is our technical advisor. You can sign up for CHLY's newsletter at chly.ca/subscribe for updates from our nonprofit newsroom and more. Our theme song is First One by local Nanaimo band Waste Management. If you have a story you'd like us to cover, email us at news@chly.ca. That's all for now. I'll talk to you on another Midcoast Morning.
Midcoast Morning would not be possible without the funding of the Community Radio Fund of Canada's Radio Meters program and listeners like you. Midcoast Morning is a project of CHLY's nonprofit newsroom. Support nonprofit journalism in Nanaimo and on the Salish Sea today by becoming a monthly sustaining donor at $5 or more per month. Support the program at chly.ca/donate. Finally, this program acknowledges and gives thanks to the Nanaimo First Nation as we broadcast and podcast from their traditional territory. Thanks for listening.